So let's talk a bit about the consequences of what the feds are pitching and how it's being received by the provinces. With the front bench joining me this evening, former New Brunswick Premier Brian Gallant. He's now the CEO of Space Canada. Former Alberta Premier Alison Redford. She's now the principal at the Redford Group. NDP strategist and Monk & Associates principal owner Kathleen Monk is here, as is the Toronto Star's Queen's Park Bureau Chief Robert Benzie. Hi, everybody. Nice to see you. Great to have you with me this evening. Brian, I'm going to start with you. The contrast in those numbers is kind of stark, and we could hear it through that press conference. I'm not sure how much you caught, but even Premier Steffordson a few minutes ago on this program called it a little bit disappointing. How much leverage do you think the premiers have to go back at the federal government now?
Well, let's start off by just acknowledging that a lot of this is happening through the media, and clearly the Trudeau government has been doing the best they can to sort of prepare things coming into the meeting, maybe some leaks, maybe some sort of expectation markers that they put out there before the meeting. They're calling it a working meeting to make sure that it's clear that they want to engage with the premiers, but really they very much put a detailed plan out there. So that's context piece number one. Context piece number two, as you mentioned, Vassy, the premiers has put a stake in the ground where they were hoping to have quite a bit more than what's been put on the table. But they've also, in some of their press conferences today, started to soften that a bit as well. So clearly saying it's disappointing is what they have to say based on how there's a pretty big discrepancy from what they've been saying for months and what has been presented, if they want to be able to take on what was presented or some version of what was presented today. I think if I'm to be fair to all parts, they stayed together over the last few months as premiers to ask for what they wanted in terms of funding. But I do think the Trudeau government coming in handled the sort of the communications and perception of things quite well today. And again, presenting a pretty detailed plan, but also at the same time in parallel talking about how this meeting is a working meeting and that they're going to be figuring things out, rolling up their sleeves with the premiers. And no, there won't be a deal today. But when you look at the detailed proposal, it looks like an agreement.
Yeah, the thing is, the level of detail, Alison, is so much that if they've put this timeline to get an agreement before the federal budget, like how much room for back and forth is there actually?
Well, I think that everyone was very cautious today in the Premier's press conference. And I think part of that is that they're realizing that they don't have a lot of flexibility. And one of the reasons they don't is because the agreement or the proposal is so detailed that if you start to pick one part of it apart or try to negotiate something differently, you're going to end up being told, or the discussion will be, that the rest of the agreement will fall apart. And so therefore, I think it's going to be very difficult for premiers to pick on a particular point that they might be concerned about. However, the bilateral agreements are an opportunity for the premiers to be able to deliver the healthcare services that they need in their province right now in the manner that they choose to do that. And I think that if you go back to the original principles of the Canada Health Act, which were to fund health outcomes with federal money, that if we can stay true to that principle and allow premiers to have flexibility in terms of how they deliver, as long as it's a universal healthcare plan, which can still allow for publicly funded private delivery, that sort of thing, which is certainly something we talk about in Alberta, that you're then going to be able to see where there's some flexibility. But I think that it is a little bit of I don't want to say house of cards in a negative way, but if you pull one card out, it complicates everything. So I think you're really looking at what provinces can do in the bilateral agreements.
I think Alison makes a great point, Kathleen, because the level, both Brian and Alison, and the level of detail that's in there outside of the bilateral agreements, which have a few things in that press release, like here's what we hope you spend that money on, but really will be open to, it seems like, more fruitful, maybe, potentially fruitful negotiations with the provinces. Maybe that's where they get some of their political wins.
For sure. And there is still a big pot of money in those bilats, that $25 billion, I think it is, for just the bilats. So, and that's where the devil's in the details in terms of how they're going to work that out over the next few days, few weeks,
hours,
hours maybe.
I
know it doesn't. It really doesn't. But what's interesting to me is just there has been such a build up to this, right? 18 years maybe since the last big, working meeting on the Canadian healthcare transfer. But certainly you would have to the 36 meetings that happened during COVID with these premiers and the Prime Minister constantly calling for more substantial health funding. It was denied. The Prime Minister constantly balked at talking about that during the COVID crisis. And then again last July, the Premiers invited the Prime Minister to join them in Vancouver to have a real conversation about the healthcare transfer. And then we come today, and it's a bit of a disappointment. It's a bit of a nothing burger, or not. But the Prime Minister still has a chance to frame this himself. He's coming out in another half an hour. The Premiers obviously have done their best throw at trying to frame it as not being enough. So it'll be interesting to hear from the Prime Minister, his team. He's bringing out Freeland, obviously Minister Duclos, to say how they want this to be accepted by Canadians.
Yeah, and we'll carry that press conference at 5:30 Eastern live here on Power Play. Rob, you've been in the room the whole day. What is your sense of, were the Premiers actually surprised by what the Prime Minister tabled today?
I mean, I think, Vassy, they are surprised and a bit disappointed, as Heather Stephenson was saying to you earlier and Premier Doug Ford was saying on the stage. But I think they see this as the beginning of a longer conversation. And the fact that they're even having this conversation is a really good sign. Because remember, there were years when the Prime Minister of the day didn't necessarily meet with the Premiers to discuss health funding. It was just sort of, here's what you're getting, now run along. And I think that's not insignificant. I think the other thing that I was surprised about today, Vassy, was that how few strings there are attached. I mean, I was expecting more conditions on this funding, and maybe it's because there is so relatively little new funding that there's no point in attaching conditions to it.